let's get right to it. I've asked our panelists to give us some opening statements on what they think fraud and waste and the situation with fraud and waste and accountability is present day. And then we're going to close. I told them our closing statement, if they could talk to the Senate policy chairman on health care, what would they advise him or her to do in this legislative session? Let's kick things off right now. Jason Delimitros is the Chief Operating Officer of Sunshine State Health Plans, as you know, a division of Centene Corporation, and has been kicking fraud and waste and abuse for over 15 years. Jason, welcome. We're glad to have you here. Happy New Year. The mic is yours.
Happy New Year. Excited to be here. Yes, I'm the Chief Operating Officer for Sunshine Health. We administer health care for about 210,000 Medicaid recipients.
Talk right in here loud.
And certainly fraud, waste, and abuse is an important topic for us as it takes money out of the system that could go to other places in preventative care.
Very good. Okay. Nice. Okay, Debra. Faulkner has a handful of degrees, master in business administration, master in health, and is a managing principal with Verizon Connected Healthcare, and has a long list of credentials of how she's been operating her firm and attacking fraud and waste and bringing accountability. Debra, welcome. What are your thoughts?
Thank you, Senator. Guys, I'm really proud to say that as Verizon, we are actually the platform that currently today CMS, the Centers for Medicare and Medicaid, are using in the Medicare arena to fight fraud. We currently today are processing for all 50 states. We've had the contract now for 2 years. And as of about 3 weeks ago, the actual Senate released the findings on how much savings that they were garnering out of the platform that they're currently utilizing. And they're saying for every $1 that they're spending on fraud, they're bringing back $3 in the door. So, and I know a lot of people ask, how is Verizon, a cell phone company, part of the fraud solution? We do actually have a platform that we utilized and we built about 15 years ago to detect fraud in the telecom industry. Because of all the data streaming that comes across all of the pipes within Verizon, we had to find something that was real time and was able to detect fraud in a very efficient manner. So we're able to take that platform and transform it in today to what we now are calling our Verizon Fraud Management Solution.
Very good, Debra. Welcome. I'm glad to have you here. Patrick Ross, ladies and gentlemen. Patrick Ross is a Vice President of Program Integrity Solutions for Optum Government Solutions. And let me tell you what his job is. His job is to be what we all want to be, and that is innovative. How about that? He leads a team of innovators to change the way we deliver healthcare. And as an added bonus, he is a decorated Army officer that served in Desert Storm and Desert Shield in Iraq. We salute you and thank you for your service and welcome you here. Patrick Ross, what say you?
Thank you. Thank you, Senator. From my perspective, I think the biggest thing is you look at healthcare and through Medicaid expansion and through the Affordable Care Act, more and more folks are going to have healthcare benefits that haven't in the past, okay? You combine that, a groundswell or a volume increase of significant proportion with the current payment system within healthcare of essentially paying for services rendered. That's going to continue, obviously, to escalate and put strain on state budgets and federal budgets. So I think my biggest focus, our team's biggest focus, is thinking differently, thinking outside the box. So there's a lot of program integrity mechanisms that have been used for the past 20, 25 years. Some of them work, some of them don't work. But our challenge and what we're working closely with clients on the federal level, state level, commercial level, is leveraging technology to apply analytics, to apply lessons learned through claims history differently to proactively fight fraud and abuse. Thank you.
Very good opening statements. All right, there we go. I took notes with Michael Millen, our keynote speaker at lunch, who talked about the things that get in the way of delivering health care, including unnecessary services, high admin costs, high prices, fraud. That's the one that everybody agrees on. We need to do all we can. Inefficiency, missed opportunities. If you had to name them, what would you say the top three challenges are to delivering accountability? Is it them, or is it something that we missed? Your thoughts, Jason?
So part of the problem is, as the DEA has been successful in the war on drugs, they've made it unattractive to bring drugs into the country illegally, and so people have turned to steal from Medicaid and Medicare systems from pharmacy. And so it's become sort of a cat and mouse game, and these folks will be more familiar with the technology, but it changes every year. We have to update our algorithms every year to look for people who are finding innovative ways to get prescription drugs that aren't really being prescribed and selling them on the streets, and partnering with law enforcement to do that. So I think we're evolving into a pseudo law enforcement process, and it changes every year in terms of the requirements.
Patrick, what's driving the forces of fraud today?
Yeah, I just think it's, I mean, the human mind always innovates, always thinks differently, always tries to figure things out. And unfortunately, there's a small element of fraud associated with that, criminal intent, negligent intent. So with the technology that I'd mentioned previously, we're taking a focus on, again, applying lessons learned in the past to what's happening currently. I think some of the larger areas, obviously, South Florida has been a challenge, as well as South Texas and Southern Cal, is around home-based care and durable medical equipment. So we're developing a technology that you may or may not have heard of. If you think about GPS technology, when I was in Desert Storm 22 years ago, that was the first time anyone had ever used GPS in a commercial setting. We used it to set our where the heck we were going, because there were no land features in Iraq. We're using that same technology now to track people that are driving to provide home care services. And I mean, it's a perfect segue. It's a tried and true technology. Fleet services are using it. UPS is using it. FedEx is using it. Why not apply tried and true technology in a different market, which is healthcare?
Very good. Who remembers a 60 Minutes episode where they went to Miami and shopping center after government building all had durable medical equipment offices that were vacant, but they were there. It just makes you wonder and scratch your head. Debra Faulkner, tell us about the trends you see in fraud, waste, abuse. Are there trends emerging? Do you see that happening out there?
Oh, absolutely. And I think that the trends are, one of the trends today are, as I said, is durable medical equipment, but the other one too is on physical therapy. I just got done doing a pilot study for one state and looked at some physical therapy services. And actually we detected number one case was an individual providing physical therapy and billing more than 29 hours in a single day. Help me to understand how we do this. And on top of it, in a 1 month period of time, and I'm looking at 30 contiguous days in a month, this gentleman performed more than 39 days worth of service. So, as you start to look at, the first thing everybody would say is, gee, I've got a lot of help that are in our offices that help us to supply services. And the reality is, guys, you can't have enough of an army in the centers that we were looking at to supply that type of service. I mean, it just doesn't exist. And if you do, we're really concerned about their level of care and what their educational levels are, because we weren't even looking at things such as hot packs, cold packs, diathermy, or magnethermy. We were looking at hands-on physical therapy services.
It does make you... I've got the Tums ready. Let's talk, Jason, your thought.
Well, I wanted to chime in. In addition to the financial cost, there's also a human cost. So a lot of the members we serve are long-term care members who are choosing to reside in their home-based setting of care, which is a lot less expensive than a nursing home. But the only way they can do that is if they're augmented with social services or delivery services or DME. So to the extent those services are being billed but not delivered, in addition to a financial issue, there are people who need those services to stay at home who are now at risk and could go to a nursing home facility. So it's a financial issue, but as well as a quality and a human issue.
Very good. Are there differences from federal fraud and efficiencies in state Medicaid versus Medicare? Do you see any differences, any contrast? Patrick?
A few. I think largely you can compare federal health care to state health care, and by state I mean Medicaid to commercial, right? You've got members, you've got providers, you've got benefits, you've got services authorized and not authorized. But I think where some of the nuances and the slight differences are, if you think about the Medicaid population and the lower fees associated with providing services to a Medicaid member versus commercial, I think that's a nuance where you've got to take the stance on working with the provider community differently than on the commercial side, because again, full transparency, a collaborative relationship, the entire spectrum of stakeholders understanding what's at stake and what the rules are really benefits the whole system.
Debra, your thought.
We do a lot of creative things, I think, as Ross does, and one of the things we're able to do is do heat mapping. And we've done a lot of different heat maps based upon aberrancy in different algorithms as we've created. And we're seeing whether it's Medicare or Medicaid or the commercial population, the heat maps are the heat maps. Where you have fraud and the areas that you have fraud and the different nuances within those fraud environments really all seem to be the same. I mean, we look at South Florida. Right now, it's number 1 on the hit list for healthcare fraud. You look at New York, again, it's number 2 right behind Miami, and then you look at California, you've got LA right in the middle of it. But as you start to map these heat maps, again, it just goes right back to South Florida, New York, and into California.
Right, that's the capital. Jason.
Yeah, and for us, because we serve mostly a Medicaid population, we see 2 areas that are different. So on the pharmacy side, Medicaid's intended to be the payer of last resort. But because pharmacy and a lot of other services don't have a copay, oftentimes we see the pharmacy benefit being used as a Medicaid benefit when in fact there's alternate insurance available. So that's one distinction that we see. And then as it relates to physicians and specialists, a lot of these physicians, they don't have the same type of cash flow as, say, a largely commercial physician office would. And so they live really month to month or week to week in terms of their cash flow. Well, one of the tools that we've employed, largely due to tools that my other panelists have, is when we flag somebody for potential fraudulent activity, we stop them before paying and make them justify the services were rendered. For some of the physicians who are in maybe rural areas or see mostly Medicaid, that creates a cash flow problem for them. So we end up having to put in a lot of communication vehicles and often having to have a tailored approach to make sure they don't have to shut their office down just because they're going through an audit.
And that's a difference. I know in the state of Florida, we continue to pay the bad guys.
We do.
And sometimes don't review the bills. I mean, it can be a year later, 14 months later. I've heard and seen evidence of 18 months later, we're reviewing the bill that we paid 18 months ago. Hey, wait a minute, those guys are bad guys, and they're already out of town and packed up. The difference, tell me the difference. Now, we're always looking for better ways to do business in the state of Florida. What is it different? I mean, you've got more mobility and flexibility as a private company. What would you say, what's the difference between your efforts in fighting fraud or as you see the state of Florida doing?
Sure. I'm not totally familiar with what the state does, but on our end, we do a lot of prepay review. We do a lot of extrapolation and very aggressive analytics to identify outliers and really flagging them early and often to understand what it is they're doing and why they're an outlier. Oftentimes, we'll see providers billing in aberrant patterns, and we'll flag only the high-cost aberrant charges that they have to justify, but we'll let the normal course of charges go through. And then lastly, as it relates to safety, so not only are there billing issues, but we'll find cases where there's actually medicine being performed that's dangerous and endangering the member. And in those cases, we often, within 24 hours, will shut that down and contact all the members and find alternate settings while we review suspicious activity.
Gotcha. Debra.
Well, from a state standpoint, the state has, like Florida Statute 641, which is a prompt pay statute that says claims must be paid in a certain period of time, if not, penalties and interest do accrue. That kind of binds the state in saying we can't get out of the pay and chase model. We have not found a technology up until today. I think that we've got some technologies out there now that really can look at data in a real-time streaming manner in a quick enough fashion so that we can take action before the claim goes out the door. We are still stuck in that model of we'll pay it, we'll review it, and then we'll try to go get the money back. Well, good luck. Right now today, it's looking like the collection rate is somewhere between 0 and about 30%. So if you're paying out $100 and only getting back $30 of that, it's just not a cost-effective manner. Also, too, for the states are impeded by the fact that they get federal matching dollars. And the minute this fraud has been identified, you have to identify that to the federal government. That starts the clock ticking. They have 1 year to pay back that federal match of 60%. And we've talked to a lot of legislators to say we couldn't get something through the legal system in a year to get it prosecuted and get the money returned, much less if it's really organized crime. You're not going to find the individuals anyways. So the state now gets a double hit because they've already paid out those claim dollars, and now they have to pay back the 60% federal match.
Right. Patrick.
Yeah, I would just add to what Debra was saying, and I'd mentioned before, the synergies between federal, state, and commercial. I think one of the absolute synergies on the commercial side, companies have been applying predictive analytics to stop claims payment before being paid for 8-9 years, I think now. And there's an absolute direct applicability to that same process from a Medicaid standpoint. But then you get into the again, the nuances of the provider abrasion aspect from a Medicaid perspective versus a commercial aspect. It could absolutely be done. We've got the analytics. There are a number of companies that have the analytics. I think one of the challenges in healthcare, and especially on the government standpoint, is really overcoming inertia. And if something is different than what has been done in the past, it really takes a sea change to actually make different decisions than what's been done. But I think it's that level of thinking, again, of, okay, if this has worked commercially, why not apply it from a state perspective, but apply some of these nuances that I'd mentioned previously because it is Medicaid.
Right. I tell you what, some big innovation. I think one of our previous panels called this it's a smartphone, but called it a hospital. It's both presented challenges, I guess, and opportunities for us to use technology
Absolutely.
to fight fraud, but I guess it's also given the crooks a way to use that technology as well against us. What are you seeing on the technology front now and the future of that? Jason?
So one of the exciting things that we see available to us as it relates to home care and DME is what's called electronic visit verification, or EVV. And essentially what it means is a service can be authorized for home care, or hospital, or meal service, or therapy or something. And when the provider goes to the home, they actually have to validate that they're in the home with a GPS-linked cell phone, that data comes back to us. And until we have that, we don't pay. And sort of linking the authorization of services to validating the services were actually delivered at the place they were supposed to be delivered with the reimbursement is a real opportunity.
Very good. Deb, what are your thoughts?
Well, being from Verizon, we've got a full solution. I mean, we have everything that we can take data analytics and literally, as the data is coming in, do geodispersion to tell how far away the individual went to get care. And I'm not talking about, was it a DME company billing for an individual? We actually did a state pilot by which we found individuals that were actually receiving care more than 3 miles away from their home in a single day. I mean, it can't happen. It just really shows that those IDs were compromised and that fraud was taking place. We also have other technical tools by which you can use geomapping and geolocation to actually go in and put in the actual address to find out and look at the street front to see if it's an active business. And let me tell you, we have found things all the way from empty parking lots to Palo Verde trees. When claims have been paid out to more than a tune of $1.2 million in a 6-month period of time. State didn't even pick it up. We even had that validated by individuals driving to the geolocation just to make sure that the mapping was correct. So there's so much technology. We have the capabilities that if we detect that there is even fraud, we can send an alert out to a detective out in the field, either via their iPads or via their computers or via their iPhones to say, go follow up on this, take a drive-by. Tell us what you're actually seeing. Is it really a place that is conducive to have business? And if so, what type of business is it? Or even if you are an investigator, take some pictures for us so that we can actually see what that storefront looks like.
Very good. Mr. Innovator, Patrick Ross, technology.
Yeah, just linking back to what Jason said, I'd mentioned the GPS devices, and there's a number of them. I mean, you watch the Progressive commercials on TV, Flo, I think is her name. You've got the little plug-in things that go into any car made beyond, I think it's 1995 or something like that. When you plug that into the car, it is always on, always tracking, as long as it's plugged in, okay? So if you think about the value of that, I mean, Medicaid funds transportation services oftentimes, right? So how do you, whether you're funding per visit or from a mileage standpoint, that is, again, a direct applicability of something that the car insurance companies have been using for years that you can use in Medicaid and as well as with CMS and the federal government. Conversely, as the senator was talking about, I mean, we've got iPhones here. They have GPS tracking location on here. You can triangulate. So when you go into a patient's home, you text to verify when you got to Mr. Smith's home at 11 a.m., and if you're billing in incremental units of 15 minutes, you text to verify when you leave 45 minutes later. There's your proof. There's your verification that the person that should have been delivering the services was at the right place at the right time for the total amount of time or duration.
Very good. Very good. Now, your companies you've been generous to come here today, and your companies have been generous to loan us your expertise. So I'm going to give you a chance to tell us a great success story from your company. You can brag about your company, and everybody's taking notes. What have you done? What's your biggest thing you want to brag about your company to increase accountability in healthcare? Debra, start us off.
Oh, well, I already talked a little about CMS, but I really have to talk about this state pilot that we just completed because I was actually amazed. We actually went in and did looked at 30 days in one state, and we only took our top 6 algorithms and just kind of said, what is it and where is it that we're looking at for possible fraud, waste, and abuse? We only had one algorithm that looked at one-day hospital stays, and then we had some physical therapy and evaluation and management codes that we were looking at. At the end of the day, after the state validated our results, we walked away with an opportunity of saving that state, just for those 6 algorithms, $90 million. I mean, it's huge. When you look at Medicaid today on a $457 billion spend, the U.S. House of Representatives issued a statement back in early 2012 that says more than $100 billion of that is fraud, waste, and abuse. I mean, if we could capture just half of that to be able to give every state back $1 billion to say, here you go, back into your states for your health care cost, what could we do with those dollars? I mean, it's just immense. We wouldn't be sitting up here talking about uncovered health care for any of our individuals or shortages in any of our Medicaid or Medicare programs.
Very good. Patrick, success story.
I'm not going to single out a particular one. I think it's just the relationship focus that we have with all of our clients. And I'll pick a Medicaid program where they've outsourced a big component of program integrity, function administration back to Optum. And for the last 2 years, we've exceeded the state targets, the Medicaid targets, by 15 to 20% each year. As an example, it was $20 million the first year. They wanted $20 million of savings. And this isn't a large Medicaid program. And by applying different technologies, bringing in strong subject matter experts that understand Medicaid policy, as well as that, again, that commercial experience as well, we've helped them exceed from 20 to 24 in year 1. And then the goal the second year was 24, and we hit 28 million. So I think it's just that broader focus.
Very good. Jason, tell us about a success story at your company.
We saved the state of Florida $4 million last year.
I like that.
Good job.
We're going to give you an extra 30 seconds to elaborate. How about that? Saving Florida $4 million. Tell us about it.
You know, for me, I mean, I think the technology and tools is fantastic. To me, it's the way we use them and deploy them. So we also not only find them to save money, but if we find quality stories. We highlight members who are hitting 4 ERs in a day for drug-seeking behavior, and before they hit the 5th, we're able to notify them. So there's things like that we can do that have, you know, cost savings element, but also a human benefit and a quality benefit as well.
Very good. Now, ladies and gentlemen, we've reached the halfway point of it's flown by. I know the halfway point of our little section. So what we're going to do now is we're going to move on to our lightning round. I've got a handful of questions. Our panelists will be given 5 seconds to answer. We'll alternate who goes first as we go. So we're going to get a gut reaction of what they think on this, on the particular questions. Then is where you'll come in and we'll turn it loose to the audience of your questions, and then we'll have final closing statements of advice to the legislature moving into the 2013 session. All right, are y'all ready, panelists?
Yep. Go.
Yes.
All right, very good. I take that as a yes. Jason, you're on the hot spot first. Here we go. At what percentage rate will fraud in Florida get everyone's attention as a percentage?
10%.
10%. Debra?
If it hasn't by now, we're in trouble.
Very good.
Yeah,
Patrick?
right now.
Right now.
We're past
Very
the
good.
point.
Your guess of what percent fraud and waste and abuse is in Florida's healthcare budget, Debra?
Right now, on a $22 billion, you're probably looking at, or $200 billion, you're probably looking at about 10%.
10%. Patrick?
I'd say 5 to 10%.
5%. Jason?
5 to 10.
Very good. What percent will fraud go up or down with Florida in Medicaid reform, Patrick?
10 to 20%.
Up.
Yep.
Very good. Jason?
Yeah, I'd agree, 10 to 20.
Debra?
At least that, if not more.
Very good. On average, in percentage, how much higher will Florida premiums be under the Affordable Care Act implementation, Patrick?
10%.
Very good. Jason?
Is there like a lifeline I can call?
Hey, wait a minute, we can Google it, quick.
I honestly
5
don't.
seconds.
5 to 10%.
Debra?
I don't think you can put a cap on it. If you don't do something about fraud today, they're going to continue to grow as time goes on.
Very good. What's a bigger problem? Is it waste in healthcare, or is it fraud in healthcare? Jason.
Waste.
Debra.
Waste and abuse are running about 1.5 times what fraud is today.
Patrick.
Absolutely waste.
Waste.
Yep.
Very good. Who will play in this year's Super Bowl? Debra.
Oh my gosh, not my team, the Arizona Cardinals.
That is incorrect.
I know they won't.
They're out. Two
They're
teams.
out.
One team. Name one team. Debra. Patrick.
Texans. Houston Texans.
Denver.
Jason.
Denver.
What is it?
I said Denver.
Denver. Okay, very good. All right. Would you support a financial incentive to pay to insurees who spend less on their health care than a preset target? Patrick.
Yes.
Jason.
Yes.
Debra.
Absolutely.
Very good. Is our country headed toward a single-payer system? Debra.
No.
Patrick.
Nope.
Jason.
No.
Very good. Does telemedicine have a future role to play in the delivery of Florida health care? Patrick.
Yes.
Jason.
Absolutely.
Debra.
Absolutely.
Very good, panelists. That wraps up our lightning round right there. Give them a round of applause because that was tough.